Prior to the 1970s, obesity was rare. In the past 30 years, the rate of obesity has increased exponentially to nearly 150%. 40% of U.S. citizens 18 years of age and older are considered overweight or obese, which is 4 out of 10 adults, and children aged 0 to 18 average 19% obese. It is estimated that obesity in adults in the U.S. may rise as high as 70% by 2030 of the total population, with 1 in 3 persons obese. Today, more than 18 million people are characterized as morbidly obese. Obesity rates remain alarmingly high and sustained without much effort undertaken nationally to reduce these rates. In fact, some public health officials state that so many Americans are overweight or obese that normal weight levels are now considered a minority. No significant difference among men and women of any age group exists, indicating obesity is an equal opportunistic public health condition for all aged citizens. Prevalence rates among adults aged 40 to 59 is 42.8%, which is higher than the adults of 20 to 39 years of 35.7%, and those over 60 years, which is 41%. Prevalence rates are also higher in Black and Latino children and adults and children who live in rural areas have higher rates of severe obesity than suburban counterparts.
Obesity and excess weight correlate to poor health and chronic conditions, shorter lifespan expectancies, and higher healthcare costs by 42% than in healthy weight individuals. Medical expenditures average $150 billion annually, or roughly 9% of the total U.S. gross national product. 40% or 100 million U.S. adults live with diabetes mellitus or prediabetes, and obese children have higher rates of type 2 diabetes and high blood pressure. Obesity is affecting the nation's growth, labor productivity, and capacity for resource allocation both domestically and globally. The future safety of the nation is also in jeopardy, as 1 in 3 young adults are now considered unfit to serve in the military. In 2013, the American Medical Association publicly advocated that all healthcare providers receive incentives and reimbursements for patient care and health outcomes when managing overweight and obese patients in order to sustain the future of the U.S. and future healthcare for all U.S. citizens. Currently, obesity research has begun targeting obesity prevention efforts in early childhood to try to slow obesity rates. The new policies are being implemented across the U.S. at the local, state, and federal level to improve access to healthy foods, increase access to recreational facilities, and improve urban design and city planning, and increase incentives for the worksite health promotion programs. 1 in 3 Texas children ages 10 through 17 are overweight or obese, with a percentage of 35% of all school-age children in Texas. In addition, more than 1 in 3 Texas adults are as well. 53% of Texas school-age children do not meet the recommended physical activity and strength guidelines for their age group, while 52% of Texas adults do not exercise regularly. Furthermore, almost 75% of middle and high schools do not even offer fruit and vegetables besides meal programs, while less than 25% of adults get daily recommended fruit and vegetable intake. It was estimated that in 2009 alone, obesity costs in Texas were soaring near $10 billion for the year. Due to this rise in the cost for obesity, it is causing a huge economic impact for the state. This affects things such as the cost of insurance premiums rising and even workplace productivity decreasing. Obesity healthcare costs continue to escalate due to other medical conditions caused by obesity. Texas has an obesity prevention program that thrives to make healthy options simpler for all Texans regardless of their work or lifestyle. In October 2013, the Obesity Prevention Program was created by joining nutritional health, physical activity, and obesity prevention with the worksite wellness programs. This program encourages limiting obesity, the consumption of added sugars and high calories, low nutrient foods, and increasing the ingestion of fruits, vegetables, and water. In addition, it supports increasing breastfeeding length and physical activity. The program objectives are for big sectors of the populations by promoting approaches to diminish environmental barricades, to healthy living, and organizational plans that facilitate healthy choices.
We would like to address the Medicaid Board for reimbursement on weight loss counseling. At this current time, there is no policy in place for Texas Medicaid reimbursement for specifically addressing weight loss interventions for patients. However, currently both Texas Medicare and private insurances such as Texas Aetna and Blue Cross Blue Shield have coverage for weight loss counseling. Medicare even has a policy that offers specific coverage for their patient population. With this being said, the data presented above revealing the unbelievable facts about obesity. By Medicaid paying and initiating for weight loss counseling, this could make a huge reduction to Texas's overall obesity rates. In addition, by reducing overweight and obese ratings, this would further reduce the risk of other comorbidities, resulting in the reduction of overall healthcare costs. Evidence-based policies and programs have helped Americans eat healthier and provide more opportunity for physical activity in their homes, schools, and communities. These initiatives have taken root at the local, state, and federal levels with participation from private sectors and should continue.